Okay, so today in MedSoc I'm going to be talking about lung cancer, so I'm going to outline what exactly it is, the forms, symptoms and treatments. So before I start, can anyone tell me anything they know about lung cancer? Anything at all?
Yeah, I think 7 out of 10 people get lung cancer because of smoking.
Okay. Anything else? Okay, so a short introduction to lung cancer is medically defined as lung carcinoma, which means cancer that forms an epithelial tissue, and the tissue is widespread throughout the entire body, so it lines lungs, organs, anything like that. It begins in the lungs and typically spreads to lymph nodes or other areas of the body, even to other organs, known as metastases. Once spread, it is no longer considered curable, as it's much easier to cure when it's contained in one place, such as the lungs. And here are some common symptoms. The names might look a bit confusing, but it's like the medical terms for them. So first you have refractory chronic coughing, which is a persistent cough, and it's caused by tumours irritating the respiratory tract, triggering the cough reflex. Next you have hemoptysis, which is the coughing up of blood, and it's only hemoptysis when it's blood that's come from the lungs and bronchial tubes, and this is typically the first indicator of lung cancer. Another symptom is chronic dyspnea, which is shortness of breath and persisting for quite a long time. Damaged lung cells no longer function correctly, so it's difficult to inhale and exhale as air cannot be exhaled from lungs as fast as possible. You can have unexplained fatigue and weight loss. The fatigue is due to the production of toxins by some of the cancers and tumours, which prevents the cells from forming chemicals that we need for correct heart and muscle functions, such as potassium and sodium. The weight loss is due to the tumours releasing appetite-reducing substances that cause difficulty consuming and absorbing nutrients, and unfortunately you won't notice the weight loss until it's been a few months, and for a lot of times that might be too late in some cases. And the last common symptom is aches and pains while breathing and coughing, which is caused by pleural effusion, which is fluid that collects between the lungs and the thorax, and pleural effusion also causes coughing, dyspnea and chest pains. So, has anyone heard of these forms of lung cancer? Any? So you have non-small cell lung cancer and small cell lung cancer. So non-small cell lung cancer is the most common, and it accounts for around 80 to 85 out of 100 cases in the UK. It includes 3 subtypes, one of which you're able to be diagnosed with, so you can't have more than one obviously. So there's squamous cell adenocarcinoma or large cell carcinoma. So squamous cell carcinoma begins obviously in squamous cells. These cells have a flat shape and lie the inside of the respiratory tract in the lungs, and it's often linked to a long history of smoking and is commonly located in the central part of the lungs, close to the bronchus. So a lot of smokers tend to have this form. Next you have adenocarcinoma. So here you can see a lung, and that's how large that the tumour can grow. And it begins in the cells that typically secrete substances such as mucus. Does anyone know the type of cells that secrete mucus?
Oh yeah.
So this form is mainly present in those who have a history of or currently smoke, and is also fairly common in non-smokers, as many of the lung cancer forms. You also have large cell carcinoma, which you can tell that's how big the cells are, which it might not look very big because it's just an image, but it grows more rapidly and aggressively than other forms of lung cancer, and the survival rate for 5 years is only 18%, which is lower than both of the other forms. Next you have small cell lung cancer. So there's only 2 types, which is small cell and combined small cell. This form of lung cancer is a lot more rare and spreads much more rapidly than that of non-small cell lung cancer. It also accounts for approximately only 50% of lung cancer, so again it's quite rare, and it typically spreads to the lymph nodes, bones, liver, brain and adrenal glands. So small cell carcinoma is the most common, and sadly because it's so rare, there's not much information on medical journals and everything. But combined small cell carcinoma accounts for only 2 to 5% of small cell lung cancer cases, and it's a mixture of non-small cell lung cancer and small cell lung cancer. So the 3 types of treatments I'm going to be outlining of lung cancer is surgical removal, targeted therapies, and chemotherapy. So some of the lobectomies, which is when, obviously as the name suggests, one lobe of the lung is removed. So that's how not that there's a scale, but that's what a lobe looks like in your lung. And this procedure is only recommended if the cancer is contained to such a small part, such as the lobes of your lungs. And it's the most common during the early stages of lung cancer. And you can have bilobectomies, which is obviously 2 lobes, but they usually don't take it from, it'll be that lobe and then another one, essentially. You also have a pneumonectomy, which is the removal of an entire lung, and it's recommended if the cancer is prominent in your centre of the lungs and affects 2 lobes in the left lung or 3 in the right lung. Breathing tests must be carried out in order to ensure that the procedure is suitable. So again, not all treatments can be effective for people. Physical activity can also become much more difficult post-surgery once you've had a pneumonectomy. Targeted therapies, they're used for advanced cancers, either alongside chemotherapy or alone. And some drugs can target the blood vessel growth of tumours. So these are angiogenesis inhibitors, as tumours require healthy blood vessels in order to reproduce and remain nourished. Other drug cells can target genetic mutations that have caused the abnormal cell growth, such as KRAS inhibitors. And again, with most drugs and procedures, you come with many side effects such as diarrhea, nausea, and low red blood cell and white blood cell counts. So chemotherapy is obviously one of the most common, you've definitely heard of it. It involves taking various medicines. It's usually given intravenously, which is through a tube connected to your blood vessels, or it's through your chest. The medicines can also be taken in a tablet form. They're very powerful cancer-killing medicines, and so a lot of people tend to have, they tend to be lethargic or very exhausted after going through chemotherapy. It slows the spread of cancer and relieves the symptoms when a cure is unlikely, and it can either be used before surgery to shrink the tumour or post-surgery to ensure that it ever returns. Yeah.